So the goal of this video is to ensure that you don't have to see me. I'm trying to answer the question, why should you keep your teeth at any cost? Your teeth have roots, and the roots provide function to the bone. So here is a skull. You can see upper teeth and lower teeth, right? And the teeth roots maintains the bone because they provide function to the bone every time you eat. So when I meet a patient like this one who is missing teeth and is about to have all the other teeth extracted, I ask myself, what will happen to the bone underneath? And you can see we've got your nasal cavity here, right, left. We've got your sinus, right, left. And we've got your alveolus, which is just the jawbone that holds your teeth. And you can see this is where it's holding your teeth. As soon as I remove these teeth, now this bone will be empty, without roots, and therefore not in function. Unless, of course, if we place dental implants. So every time I meet a patient, I ask myself, should I extract the teeth? And if I do, what am I going to do to maintain their bone? So number one, don't have your teeth out if you're not intending to get dental implants. And if you do, you need to be seeing someone who can do it appropriately. Implants can be done immediately following extractions, same day, or within a few months of the extraction. What's a few months? 4 to 6 months. The purpose being to place those implants such that they would replace the root portion of your teeth. And now that you have anchored teeth, they would keep this bone in function and therefore maintaining it. I don't know if you've seen the video of our previous patient, Julie, with a very nice testimonial. She had no bone. The bone has completely resorbed. All of this is gone. And it's flat, like this. And now we have to figure out how to place her implants, because here's the nose, here are the sinuses, and there's nowhere to place the bone. Sadly, I see a lot of patients like this. If you are at that stage, please call us. If you're not at that stage, maybe you need to see us for a second opinion. So what would I do if a patient comes in to see me and they've already lost their teeth and they have no bone, right? These are the most patients that I see. I have several options. I can place implants. Now, I'm going to try to simplify this, but it is complicated, obviously. At your nasal-palatine canal, right here, kind of in the middle. There's a nerve going down there, so we have to handle that. And the implant is going to come right straight to your nose right there. That's number one. I could place the implants by your piriform rim, which is the bone right to the side of the nose. Same way you're looking right there. I could place your implants on your cheekbone or the zygomatic bone right below your orbits. And typically it's 1 to 2 implants, depending on the patient and the amount of bone loss. Or I can place your implants all the way in the back here, where we call the pterygoid plates. If I had to take this one, another skull that may describe this better, roof of the mouth, pterygoid plates, all the way in the back, pterygoid plates. I can also place your implants transsinus, within the sinus, by doing what we call sinus lift bone grafting. I'll address that in another video, to where I'm going to make a window into the sinus, lift up this sinus membrane, graft bone so that we are able to come back and place those implants. I'm hoping this answered a few of the questions as to why you want to keep your teeth. And if you did have them removed, why you should get dental implants. And if you're too young, the question becomes, should you even have your teeth extracted? Delaying seeing your dentist or your oral surgeon like myself is not going to solve the problem. In fact, if anything, it makes it worse, because most of the patients I see, I wish I had seen them 5 years earlier, 10 years earlier. So make a decision and act upon it. In a nutshell, life happens. Could be fractures, dental caries, periodontal disease, It could be genetics. It could be anything. But now you're losing the teeth. We're there. Just make sure you weigh all your options appropriately. What happens once the teeth come out? Are you getting dental implants? Are you getting dental implants with removable, what we call overdenture, or fixed teeth? Are you getting bridges? Are you getting full dentures? If I was in your position, well, maybe consider a second opinion. Heck, a third. This is a big deal. It is something you'd have to deal with for your lifetime. Nothing is impossible. All I'm saying is make the right decision for you. Thank you.